Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. As the last time we expected that it would be kind of a discharge back letter or a referred back letter, that is the kind of the letter that came. So now, obviously, when this kind of letter has come, the maximum probability that this time when the exam will come, the maximum probability is that because there are two major kinds of letters. So I would like to tell you about these two letters. So there are two major kind of letters in OET. So if I say discharge back letter, these letters are often repeated because discharge back means the patient has come from a particular place, suppose a nursing home, and is going back to the nursing home. So when patient lives in a nursing home and he has come from nursing home, that basically means that social history and medical history is well known to the nursing home. So that means in these kind of letters, we should not write social history and medical history. That is why these letters are repeated. That is the only reason, because they want that you should they want to test your knowledge, they want to test you being medical professionals. So that is the kind of letter. So in this letter there are two punches which are very important in the first paragraph. So in these kind of letters we write, this letter is being written, this letter is being written regarding your resident Mr. X. So this is the first punch because he lives in a nursing home. That is the permanent address of the patient. So we say this letter is being written regarding your resident. So this is the first punch. Mr. X, who was admitted to our hospital due to falling at the nursing home. So we tell them because he fell in the nurse. Don't say at your nursing home. This becomes objection. This means that we are complaining. So never write your. So we say at the nursing home. So this letter is being written regarding your resident who was admitted to our due to falling at nursing home. So required treatment. So yeah, after required treatment, he is better. He is better. When the patient is better, obviously, so he is being discharged back to the, so he's being discharged back to, he's being discharged back to your nursing home. So now this is a positive line. So you can say he is discharged back to the your nursing home, or you can say the nursing home. So he is being discharged back to the nursing home. And the last line, which is the purpose, which is the purpose of the letter, is yet missing. Now, yeah, once he reaches there, this is the perfect word. Once he or she, this is the main line. Once he or she reaches there, then once she reaches there, you are advised to follow few instructions for his speedy recovery. So this is a kind of a letter that comes alternatively, because in this letter, now you cannot write Mr. X lives alone, because as soon as you write Mr. X lives alone, so obviously he is already living in a nursing home. So social history is not relevant. If you say Mr. X is a known case of diabetes, so these people already know that he is a known case of diabetes. That is why social history and medical history is not required in these letters. And that is why these letters have a bigger discharge plan. Always. Because the second paragraph would be during hospitalization. Patient was during hospitalization, plaster cast during hospitalization, yeah, after hospitalization, yeah, on the day of admission, x-ray was done and he was found with fracture because he fell down over there. So he was found with fracture, therefore plaster cast was applied. So these kind of letter will comes alternatively, therefore plaster cast was applied. So this is a kind of a letter which is repeated in OET. So the last time we were thinking this kind of a letter will come, and most probably this kind of letter came. If this kind of letter did not come the last time, then obviously this will come now. So it would always be an alternative letter. Sometimes rather than nursing home or a discharge back letter, it can be a referred back letter. Referred back letter means now you are discharging the patient. Not discharging back means you are discharging the patient back to a place, that is nursing home. Referred back means that you are referring the patient back to his GP. So that is the difference. So refer means you are referring to a person. So in this case, if you are referring the patient, you will be referring to his GP. So otherwise, in that case, if you are referring the patient back to GP, so you will say this letter is being written regarding your known patient, Mr. X, who was admitted to falling at nursing home की जरूरत नहीं होगी. After treatment, he is better, so he is being discharged. So in that case, you will not say discharge back. He is being discharged back. He is being discharged after being his GP. Now being his GP. So what I want to say by this method, please do not lose the concentration. It's very important. So in this kind of letter, when it is a referred back letter, so I'm telling the GP, this is regarding your patient, non-patient, who was admitted to our hospital due to falling. After required treatment, he is better, so he's being discharged. Now, being his GP, you are requested to provide him follow-up care. So this is the second kind of letter that comes in the exam. And in this also, again, the same thing will happen, that obviously you will tell the GP on the day of admission, X-ray was done, he was found with fracture. The rest of the letter remains the same. So this is mostly a letter, referred back letter means referring back to the GP, and you say being his GP, you are requested to provide him the follow-up care. Otherwise, GP will never provide the follow-up care. If GP is providing the follow-up care, that means 99% that letter is to the patient's GP. That means the GP belongs to patient. That is why he is providing follow-up care. Otherwise, GP will never provide, the doctors will never provide the follow-up care. So these are the letters which come alternatively. So as we were discussing in our Mohali Phase 11 Institute yesterday, that this is the letter we suspected will come the last time, was supposed to come the last time, and they were saying it came. So now what we are left up with OET is that the letter will come as a discharge letter. Discharge letter, my dear guys, means there would be a discharge plan. Discharge plan means that patient has recovered, no matter what the problem was, patient has recovered, therefore he is being discharged, and but he still needs follow-up care, and hence is being referred to you. So this is simple letter. So discharge plan letter mostly comes to community health nurse, community health nurse, community health manager, or it can come to community health nurse, community health manager, or it can come to social worker, because these are the guys who will provide the follow-up care. So patient has recovered. So in this letter, you will say this letter is being written, written regarding Mr. X, who was admitted to our hospital due to fracture or due to falling. After required treatment, he is better. So he is being discharged. Now it is a big line, so I will break the line. I will say, however, he still needs, this S is very important, follow-up care, hence is being referred to you. So if you will see the difference between the two, the only difference is this letter is being written regarding your non-patient. And in this, you will say simply, this letter is being written regarding Mr. X, who was admitted to our hospital. After treatment, he is better, so he is being discharged. However, he still needs follow-up care, and hence is being referred to you. So that means we are telling the community health nurse and manager or social worker that, however, he still needs follow-up care and hence is being referred to. So this is how simple OET is. This is the simplest way of writing. But what has not come in the last 10 to 12 times is a simple visit letter. Simple visit letter means there would be almost 10-20 visits. So there would be almost 10-20 visits to, or maybe even 7 visits, 8 visits to confuse you. And lot of data would be given. Lot of data would be given. So please understand, in these kind of letters, the most important visit is today visit. Why? Today visit is the most important visit because it is the current condition of the patient. And these kind of letters are mostly sent to senior doctors because current condition is worse. So that is why we refer the patient to senior doctor. Suppose, let us see. Let me give you an example. This letter is being written regarding, and listen to this video 5-10 times. These are the only letters which can come in OET. So if you listen to these videos, your OET syllabus is over today only. So if you listen to this letter 5 times, your writing is done for OET. There is no other writing that will come. This letter is being written regarding Mr. X, who has been diagnosed with multiple sclerosis, or maybe any other disease. You can say Alzheimer's disease, or you can say has been diagnosed with fracture, or has been diagnosed with ischemic heart disease. So there would be a complicated problem. So write only that main problem, ischemic heart disease. On the basis of current, no full stop at all, nowhere. So you will say this letter is being written regarding Mr. X, who has been mean it is today, present. Has been with third form means it is a passive voice of today. So that means who has been diagnosed with means we are talking about the current condition of the patient. If it would have been past, I would have used was. अगर ये past होता तो मैं was का use करता. लेकिन अगर मैं was की जगह has been का use कर रहा हूँ, if I am using has been, that means it is current condition of the patient. So who has been diagnosed with IHD on the basis of his current signs and symptoms. So this is the first line you will write. No matter how difficult, how complicated the letter is, just write only the current main problem of the patient. This letter is being written regarding Mr. X, who has been diagnosed with this on the basis of current signs and symptoms. Therefore, he is being referred under your expertise on urgent basis. That's it. That's it. You can say urgent basis. Yeah, that's enough. So this letter is even simpler, but lot of data will be given that will confuse you. But if you will stick to the basics, you will not have any problem. So you will, and this is the letter that comes to doctors. Doctors ke case mein, this letter will not come. It would be either discharge back, referred back, or it would be this visit letter. In cases of doctors, yani in medicine, only these two letters come. Discharge letter never comes. So these are the two possibilities. So this letter is being written regarding who has been diagnosed with this. So you are, suppose if you are writing to neurologist, so you are writing the current problem as multiple sclerosis. Suppose you are writing to psychiatrist. So obviously in that letter, the problem would be Alzheimer's. Suppose you are writing to orthopedician. In that case, the letter would be on fracture. Suppose if you are writing to a cardiologist, that letter would be of IHD. So this letter mostly comes to the specialist that, see sir, he is having this kind of a problem, so only you can treat this patient. So maybe you can say ectopic pregnancy. In that case, the letter would be to obstetrician or to a gynecologist. So this is how simple OET is. It is just about finding the right thing. You don't have to explain everything. Then the second thing, then it would be social history and medical history of the patient. And obviously, when you're writing to the senior doctors, you have to tell what kind of medications he's taking. So medications are also important in these kind of letters. So the second paragraph, social history, medical history, medications, second paragraph is done. Then in the third paragraph, you say during hospitalization, that means when he was there with you, what kind of a treatment did you give? So you tell, or you can say visits, or if it is a visit letter, so you will say you can club these 7 visits or 8 visits. You can say during initial visits. So try to club it. Lot of data will be given, but only write basic things during initial visits. Visits means S means lot of visits. So you want to combine 3 or 4 visits. So during initial visits, the patient was lethargic. So now you can combine the data. The patient was lethargic, was feeling fatigue. You can write all those things you want to write according to the letter. Then you can say in the later visits, yeah, you can mention the date as well. On 28th January, whatever the date is given, he had this problem. So means you will write the main data. So you can combine the visits, or you can also write on subsequent visits. So you can combine the data according to the situation. So these are the 2 words which you can use during initial visits and on subsequent visits. Subsequent visits. Yeah, this is the spelling. Subsequent visits. So in this way, you can combine as many visits as you want. So on subsequent visits, he had this and this problem. Then today, whatever the data has been given today, try to write it maximum. Don't skip too much data from today, because today is the most important thing. Today, you want to tell the current condition and you want to explain the doctor what exactly is that. Doctor, today the patient is behaving abnormally. Yeah, he has abused the doctor and threatened the doctor and threatened the doctor. You will explain everything. Therefore, he is suspected with, or he is diagnosed with acute manic episode. Diagnosed with acute manic episode, for which your expertise is highly required. This is how you will end the letter. Please listen to these recordings. I have covered everything about OET in this video of just 25 minutes. Everything has been covered. Please listen to this video 2-3 times. You will never face. So this is a kind of a letter where data would be given. So don't get confused. Don't write everything. So if we talk about today's letter, this is the best example which we can do of today's letter. So that is what I'm saying. This is what I'm expecting, because it has not come for a long time. Otherwise, obviously, a community health manager discharge plan types letter will come. If we are talking about this kind of a letter, so this is the best letter I can tell you, I can show you of today's. So this is the letter. So in this, what is happening? Now the patient is being referred to gastrointestinal surgeon for the assessment of operation. And today he is asymptomatic, but continues to take omeprazole, wants to stop therapy, taking on board lifestyle change, stopped smoking. So what is happening in today's letter? Patient is asymptomatic now. Everything is fine, but he is worried to take tablets for the rest of the life. So that is why he is being referred to you for the assessment of operation. So by chance, if you are unable to understand any aspect of this letter, so you can simply write this thing. Let's see what has happened to this patient. In this letter, the patient is having Barrett's esophagus. So now when you know the patient was having Barrett's esophagus on 25th November, so he was advised to make lifestyle changes. Medications were prescribed. Now he is asymptomatic, but he needs to take omeprazole. He is worried to take these tablets for rest of the life. So he was having Barrett's esophagus. So he was advised to make lifestyle changes in November. And in January, November, December, January, that means after 2 months, he is perfectly fine. But now the problem is that he does not want to continue medications. So this is the current problem. So he is being referred to you for the assessment of operation. So now, if you understand this letter, please keep the concentration high. If you will say, I will not do anything today apart from this, but if we are doing something, then we should do it very nicely. So that is the whole logic behind this thing. So I'm just going to write it here. Now I know about this letter. So let's follow the basic. This letter is being written regarding, only write important thing regarding Mrs. Please try and understand, make it that simple. Mrs. Y, who was diagnosed with Barrett's esophagus and hence was advised to make lifestyle changes and few medications were prescribed. Will please follow the basis. Again, such simple thing. So she was diagnosed with Barrett's esophagus, hence was advised to make lifestyle changes and few medications were prescribed. Today, she is asymptomatic with the help of medications. But now, again, make it simple, but now she does not want to take medication. She does not want to continue medications for rest of her life. Therefore, she is being referred to you to assess for fundoplication. Make it that simple. So I have covered everything. So I've told the senior doctor, gastrointestinal surgeon, that this lady came to me with Barrett's esophagus, was diagnosed with Barrett's esophagus, and she was advised to make lifestyle changes. See the nice connectors, and hence was advised to make lifestyle changes, and few medications were prescribed. This is grammar. Was plus third form means passive voice. Who was diagnosed with Barrett's esophagus and hence was advised to make lifestyle changes, and few medications were prescribed. Today, she is asymptomatic with the help of medications, but now she doesn't want to continue those medications, the medications. Therefore, she is being referred to you to assess for fundoplication. So that is how you can write. If you want to make, by chance, if you want to make it very simple, then you can also simply say that who was diagnosed with Barrett's esophagus. Now she is asymptomatic. Now she is asymptomatic and she is being referred to you to assess for fundoplication. You can write it that simple. So you can pick only this data, who was diagnosed with Barrett's esophagus, but after treatment, she is asymptomatic. Now she is being referred to you to assess for fundoplication. Even then you will get the complete marks. Obviously, in this case, when you are giving good explanation, you will get better marks. So that is how these letters go. But the main topic that I wanted to tell you is not this. It was the main thing that I wanted to discuss with you by particularly this letter was, suppose now, if you will write everything, what has happened in this letter, if you will realize, in the past also she was having discomfort in 2009. That is in the month of August. At this time, she was assessed with dysphagia, nausea, vomiting, all the things were happening. Then again, she came on 20th November. She again were having worsened symptoms. At that time, she was assessed with hiatus hernia. So she was advised to undergo investigations. Today, on third visit, 25th November, after investigations, she was found with Barrett's esophagus. So that means all this data is not important. Why it is not important? Because now the patient was diagnosed with this thing and after treatment, she is better. So that is what doctor would like to know, that she was diagnosed with this thing. Now she is better. Now she is better. That is what only doctor wants to know. For the complete reference, I will attach uh, a link on the top. Please look at on the top right side. When you will watch the video, I will post the link over there for this complete letter. So you will understand this kind of a letter. So then you will understand that these two visits are not required. So you can simply say, if I have to write the letter now, so the next paragraph which I would like to write is simply would be like, on first two visits she was having discomfort. So I will mix up all the data: discomfort in stomach and burning sensation. So I will mix up all the data, and please don't feel scared in the exam that you're missing the data. On the first, she was having children. Therefore, she was advised to undergo few investigations. Write this much only, such as this, and this. Then you will say, simple, itna hi likhna hai. That is the only thing you have to write. On first two visits, only the main symptoms. Therefore, she was advised to undergo few investigations. On third visit, simple. I'm telling you this simple. On third visit, her endoscopy revealed this, revealed esophagitis, and this, the second thing. She was diagnosed with Barrett's esophagus. So this is the main letter that you will write, Barrett's esophagus. So means what I want to teach you by this letter, don't worry about these two visits. Don't over explain. Don't over explain. That is the only thing I want to teach you by today's complete video. That please don't feel scared. So only mentioned on third visit and today in a nice way. So consume your data for the last visit majorly and last second visit in this letter, because that is where the patient has been diagnosed with Barrett's esophagus, which is the main disease. So which is the main condition of the patient. So that is why you would like to cover these two visits. So you will feel very scared that you are not covering all this data, 18th and 20th. But don't feel scared. This is not required. So try to write only the main things, and that is the only main thing, having discomfort and this. Therefore, she was advised to undergo few investigations. On third visit, her investigations revealed this and this thing. So this will maintain the flow of the letter. And sorry for a big video, but it is not a very big video. It is just, we have covered different kinds of letters. Obviously, it will require patience to listen, but you can listen this video by dividing it into 10 minutes, then 10 minutes, then 10 minutes, and then 10 minutes. So you would be able to do 3 different kind of letters, which comes in the OET exam. And apart from these letters, there is hardly any chance. Then the last thing, in the last exam, somebody was saying, in OET paper, it is written, don't write more than 25 lines. So what sometimes students think that 25 line means 1, 2, 3, 4. No, these are not 4 lines. These are not 4 lines. The total number of lines, these are 1 full stop, 2 full stop, 3 full stop. So these are not 4 lines. These are only 3 lines. So this is what they want to say. Do not write more than 25 lines, means that they want to count full stops. And what is the meaning of this thing? Do not write more than 25 lines means please use connectors. So if you will use the connectors, so obviously you will have 4 lines in one line, because it is the connector that connects 1, 2, 3, 4 sentences into one. So that is what is the meaning of this line. Don't write more than 25 lines means they are encouraging you to use connectors. So please, sometimes people get confused about this small thing. So now I will stop the recording. I appreciate your patience, and especially the YouTube followers, because obviously you are taking lectures, so you must be little active with me because you know I'm going to talk to you. But for the YouTube followers, please listen to this video once again. This will make your life for the OET writing, and you will not confront any issues when it comes to OET writing. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256.